A few things that I've had to learn. One is that you never talk to the hard of hearing person if you're in the other room. You always need to be in the same room, and you need to get the person's attention before you start to talk. You need to keep in mind that nobody wants to be hard of hearing. So just use as much patience as you can with the hard of hearing person.
Being nearly deaf in a hearing world can be difficult, but Carl uses some simple coping and assistance devices and approaches that can make a real difference for anyone dealing with hearing loss. Carl and Deb combine an extra loud doorbell and telephone with a light alert system that lets Carl know if someone is at the door or calling. Carl also uses a voice carry-over phone with a display that allows him to communicate with any caller, relaying the messages through an operator. A loud alarm and placing the smoke detector directly above his bed assures that Carl will see it, even if he can't hear it. And even simple things, like getting up on time, can easily be adapted for the hard of hearing. Carl uses a massager linked to his alarm clock. Watching TV is even easier than many people think, because most TVs today come already equipped with closed captioning.
It should again be an option for women.
Carl says awareness and education are key to coping with hearing loss and offers this important advice.
As we grow older, you got to admit that you lost your hearing, and if you wait too long, you're going to have to start over again.
In the U.S., about 12,000 babies a year, about 33 babies a day, are born with hearing loss, making it the #1 birth defect. Proper hearing is vital for developing speech and language skills, so early and thorough hearing assessment is imperative. And as children age, a variety of factors can affect their hearing. It's vital to recognize the warning signs and to understand the treatment options.
What sound does an elephant make? Show me your...
From birth, children rely on their hearing to develop the skills to speak, read, and communicate.
Holding the baby's tail?
Most parents take it for granted, and it is very normal for kids to have normal hearing. When hearing isn't normal, it can be very subtle as far as the clues that your child's not hearing. And that's a problem because the earlier you can catch it, the more you can do to intervene and make the child's life more normal.
Most hospitals are required to perform a standard hearing assessment on newborns.
It's a test called the otoacoustic emissions. They make little clicking sounds that the baby can hear, and then there's electrodes placed on the baby's scalp, and it can detect if the brain is hearing those little clicks. So it's a ballpark hearing test, but it's pass or fail, and most of the kids are going to pass that. And the few babies that don't pass that test usually are going to not pass it because of fluid that's behind the ears from birth.
A child's pediatrician should also perform regular hearing assessments, and as children get older, their hearing often is affected by ear infections. In fact, middle ear infections are the most common illnesses in babies and young children.
The most common hearing problem that we see with children is due to otitis media, middle ear infection. And those are kids that generally go to daycare and get lots of colds, and when they get colds, it clogs the eustachian tube, which is the air passage from the back of the throat to behind the eardrum. And air can't get behind the eardrum, and it gets all weepy and irritated, fills up with fluid, and that fluid then becomes a barrier for hearing.
It's not always easy to know if your child has an ear infection, and it's important to look for some possible warning signs. Do they tug or pull at their ears? Do they cry more than usual? Do you see fluid draining out of their ears? Do they have trouble sleeping? Can they keep their balance? And of course, do they have trouble hearing?
There's been many guidelines regarding how to treat otitis media, and I would like to say it's a simple answer, but the truth is it's not. And we are probably guilty as a medical profession of overtreating otitis media for many decades. In general, when a child has an acute ear infection with a bulging eardrum, it has pus behind it, it's inflamed, a child that's crying and fevered and obviously in pain, we are going to treat that child with an antibiotic. It has about an 80% cure rate after 2 weeks. If you don't treat an ear infection at all, there's about a 75% cure rate.